Hello and welcome to the presentation of availability, accessibility and acceptability in health services. Let's quickly look these three terms. These three terms are often confusing and some people regarded it as a synonym for each other. However, these three terms are interrelated and one need to understand that without sufficient availability, accessibility of a health service is not guaranteed. And without acceptability of a health service in a population, the service might not be used by that local population. So it is important to understand the concept of availability, accessibility, and acceptability by any health provider. What is availability? Availability of a service means there are adequate services are available and there is an opportunity for local area people to gain the benefit from that service. So it simply means the sufficient supply of health providers and health workers. So moving on to the accessibility now. Term accessibility is little difficult to understand. It means the equitable distribution of services and accessible, if you can think of that, people may have availability of services. However, the population might not access that particular services. For instance, it can be due to lack of communication or there's lack of transport. So let me explain you with one example that, for instance, there is some diagnostic screening test is provided and you can see that it is provided in a hospital which is located in a urban setting. Now what's happened for the rural population? The rural and remote area people, there are chances that they don't know about such facility or they are unaware of such kind of facilities are available, or it may possible that the people cannot travel. There are no buses there, or there are lack of transportation out there. So you can see that service is available, however not accessible by the people. Let me explain you a bit of it. The dimension of accessibility uh, can be a little bit overlapping. If you see that it can be because people are not able to access the healthcare facility because of physical accessibility, no buses are available, or there was some discrimination. So the non-discrimination is another dimension. Then information accessibility, people should be informed prior to giving any services are there. Affordability. Affordability is mostly related to your cost. So moving on, let's quickly do the component of acceptability. The acceptability should be considered whenever we design or evaluate or implement any healthcare facility in a population. The health services should be according to the client or the population need and should involve the component of social acceptability. The hospital or the facility must involve effective communication and cultural competence, and it should consider the patient, families, and the community's needs rather than implementing their own thoughts or the process to the vast majority of community. Notice that the health services may be available and accessible, however, without acceptability of a service, people might not use the service. Overall, the in conclusion, I would like to say that identification of the factors such as structure and the cultural, one can understand that the disease is not limited to the textbook, or we can go and provide any health services to our community without thinking deeply on the aspect of accessibility and mm, acceptability basically. So overall, to ensure the right of for the health, the understanding of the component of availability, acceptability is an essential component for any health practitioner. All these points are just to ensure that the health should meet the need of whole population. It should be justice for each and every individual in a group or a population, rather than only rich people should enjoy the health or only the urban people should enjoy the health. It shouldn't be in that perspective. So I think it clarifies the doubt about these three words. Thank you very much for being with the presentation and hope this will help you.